One set of strikes ends, another is set to begin. This time, nurses, including A&E and cancer care, possibly at the same time as junior doctors. NHS leaders warn of dire consequences.
We would be in genuinely uncharted territory. The NHS has never had to face that prospect. It would be incredibly difficult to manage the challenges and risks there.
Those running hospitals are worried.
It really would be very much on a shoestring, because we'd have to rely on people that we say, for example, consultant staff, but without the support of nurses in A&E, it would be extremely difficult for them to provide the care that I know they'd want to. It would inevitably lead to much longer waits in A&E, and that causes risk within itself. And it would further reduce the number of elective or operations outpatients that we've been able to just about provide during industrial action, both of nurses and doctors over the last 4 days.
But recent polling suggests broad support for the nurses' demands for better pay and better conditions. No exceptions outside London's University College Hospital this afternoon.
Well, I think they deserve more money, don't they, obviously?
You support, you think they should keep going?
Yeah, definitely.
You support the nurses in there?
I think we do, actually, yes. I mean, I think they need more than they've been offered, and I think the government should cough up a bit more. I think the doctors probably is a bit unreasonable, 35%, but you know, that we're losing so many of them.
My daughter works in the National Health, and she gives what she can give to people within the environment that she works in, but that environment needs to be improved for those wonderful people who work in the National Health to be able to give more fully what they are capable of giving, and that is what they're fighting for.
These are dark days for the NHS, because ultimately this is about much more than just pay. Stress levels are high, morale is low, and yes, Unison members have accepted the latest offer, but there are clearly huge numbers of healthcare workers who are deeply unhappy.
The Health Secretary yesterday called the RCN strike vote hugely disappointing. The negotiating table feels a long way off.
How are we going to solve this? Is it really going to be just a case of one side capitulating?
Just fixing the pay side of the current problem may help a bit, but I think we need to see this in the context of a much bigger problem of high levels of work, staff burnout, high levels of stress, and people leaving because they don't feel that they can work flexibly, that they're not feeling valued. Just fixing one bit of that problem is unlikely to solve the long term.
Add to nurses, ambulance workers, teachers and the civil service. Across the public sector, the same themes apply. The system is creaking. More ballots loom, more strikes are planned. Unions say the government has to listen.